Hi. What should you do if you are booking an appointment with your medical aesthetic practitioner to have a dermal filler treatment? What's really important is to have a think ahead of what you'd like to achieve and what your concerns are. Bring any photos you have of when you were looking well and at a result you want to try and achieve. We are always wary of people who bring photos of celebrities because our faces are so different. What's more helpful for us is photos of what you look like before, and we're trying to restore something rather than create an entirely different face. We always want to know about medications. So if you're on antibiotics for a chest infection, a sinus infection, a urinary tract infection particularly, you're not going to be suitable for treatment, and we recommend you wait at least 2 weeks after your infection has cleared to make sure you're fit for treatment. If you think of a dermal filler, it's an injectable gel, and they're often going quite deep in the face or in the temples or in the jawline, and we want to put in that product as cleanly as possible. Think of it almost like an implant, and so we want a squeaky clean skin, so we're going to take off makeup and ideally come makeup free if you can. Plan ahead plenty of time, make sure you have something to eat. Give yourself enough time to get there so you're not ruffled or unsettled coming into an appointment where there's going to be a bit of discomfort. We'll ask you to do a consent form. We'll take photos. All your information is going to be completely confidential and is never shared. We have sisters or family members who don't tell one another they're having treatment, and that's absolutely their prerogative, and no information is ever shared. If you've got a family event or a big event, bear in mind you could have some bruising, some tenderness and swelling, and although we call them lunchtime procedures or 10-minute nose jobs, these are terms I don't like, they are medical procedures and they can have side effects. The worst that could happen with a filler is it gets into a blood vessel while it's being injected, and in incredibly rare circumstances may need to be dissolved there and then. So you've really just got to plan ahead and not trivialize it. Your aftercare is going to be no makeup that day at all, and that's really important because we don't want infection, we don't want pets licking your face, we don't want you going out and doing vigorous exercise because we want to let everything settle, and you need to be around for a couple of days afterwards so that if you had a complication, you're within reach of your practitioner. So things like toxin or botulinum toxin, I would say, yep, go and fly the next day if you want to. But things like dermal fillers, I won't do treatments within a couple of days of me going away for a break, even though I have a buddy system with a colleague to follow up if I'm away. I would say, if you're having dermal fillers, stay put for a couple of days so that you're in reach of your practitioner if you had a rare complication. Just keep in mind, if you're not telling family or friends about procedures, that you're aware you could have some bruising and how are you going to manage that. These treatments are entirely private and personal. Some people tell their friends and family, other people want it absolutely secret. So that's your choice and it's your body and your face, but we can't promise that you won't have a bruise or a side effect. So bear in mind about timing of when you're going to have that done. If you're having something like lip filler done, yes, you're going to get some swelling, you could have some unevenness and some bruising. So really try and plan those well ahead of any big event where you're going to be on show more. And then you always should get an urgent aftercare number for your practitioner. And I recommend you only see a medical doctor, a dentist, or a medical aesthetic nurse, because they'll be able to recognize complications. They'll be able to be really clean with the treatment. They'll be using good products, they'll be insured, and you will be in the safest hands, in my opinion. So you're going to be signing a consent. You want to be around just for complications. And if you're unsure of anything, ring your practitioner in advance and say, listen, I'm taking aspirin or I'm on an antibiotic. Is there anything I can and can't do? And they'll give you advice ahead of time. And if you think of dermal filler, what happens is we're putting in that implant and we want everything squeaky clean. So your aftercare will generally say, don't have any vaccines or any dental work within 2 weeks after your appointment, and ideally 2 weeks before. And that's because even something as routine as a filling, it releases bacteria from the mouth into your bloodstream, which is normal. And we don't want those bacteria then latching onto the filler and saying, hang on, what's going on over here? Let me go investigate. So anything like an active infection at the time, a healing cold sore, particularly a urinary tract or sinus infection, a chest infection, if you're on steroids for an infection, we want all of those things completely settled down so that you're in the best condition to have your treatment. Because if you're having dermal filler treatment, you're only going to be having it at most once a year, sometimes 18 months, 2 years. So optimize those conditions for us so we can get you the best results, and so we can reduce your chance of complications. And if you're in any doubt, ring your practitioner for advice. Take care. Bye.